We welcome back a gentleman that I haven't seen in quite some time, and that is Dr. Barry Taylor. Welcome back.
Good afternoon.
Always great to have you with us, the author of the book, Love Your Body. And today we are going to talk about what I would think is the most important organ in the body, and that's the heart.
It is. And, you know, I've been talking with you for a number of months about the possibility of us two-leggeds, us human beings dying in our sleep, you know, because there is something called mortality. We are all going to pass. And this is a story of how few of us pass away from old age and the enormous cost to us as human beings who are dealing with cardiovascular disease, poor circulation. The statistics, Ken, are wild. Oh, my God.
Wow. All right,
Okay.
scare me.
Okay, scare me.
I'll be more scared today than I was at any point during Halloween, I'll tell you that.
Okay, Ken, the code word when you want me to stop is uncle. I'm giving you the code word.
Okay, I'm writing it down.
Okay. About 840,000 men and women die of heart disease every year. That's 1 in every 3 deaths are from CVD, cardiovascular disease. It's the leading cause of passing away for both men and women. However, it's much more prevalent in men. About half of all men who die of heart disease.
Okay, so why would that be?
Well,
because I've heard this before, but never actually knew.
You want to
why.
know the risk factors? It's called diabetes, smoking, being overweight, not just a little overweight, but we're talking about the distinction between somebody who's overweight and obesity. Obesity means you got 30 pounds or more over what they say is ideal. That's the difference between overweight and obesity. So obesity, smoking, alcohol, poor diet, physical inactivity. Do you know anybody who doesn't? I mean, given the amount of people that have got not 5 or 10 pounds to lose, but 20, 30 pounds.
Oh, yeah.
Good. You don't smoke, thanks. And I'm not saying you have to be a teetotaler and never drink alcohol.
Right.
But risk factors are enough so that 1 in every 2 men that you and I know are going to die of heart disease rather than just going to sleep and your number's up and you get called. But here's the thing. You ready? Uncle is coming soon. I can feel your mouth opening. Here it comes. Ready? It's $350 billion a year for the United States alone. The costs are staggering. What used to be a procedure that was like miraculous, like a heart transplant, there are 2,200 per year in the United States.
2,200.
2,200 transplants.
It used to be like a newsworthy
like
event.
5 or 10 or 20.
Yeah, you're right. Yeah.
Barney. Remember Barney? And 3,600 worldwide. How much is one heart transplant, Ken?
Oh, boy.
Oh, boy.
Oh, boy. I would say, let's see. I'm going to 200,000. More. 500,000. More than that. $750,000.
It's $800,000 per heart transplant. That's $60 billion, not including aftercare or medications for the heart transplants. Okay. How many people in the United States do angioplasties? You thread something up, take a peek inside from coronary vesicle disease, because coronary heart disease is a huge piece. That's different than heart attacks. About 575,000 people have a heart attack the first time in the United States per year. 500,000 people, a little bit more, close to 600,000. Get this number. 265,000 people have a second heart attack every year in the United States. Oh, my goodness. Okay, back to angioplasty. It's a diagnostic tool. Yeah. How much is it? It's about $60,000 per angioplasty, not including follow-up drugs, etc. How many people have angioplasties in the United States every year? Doom, 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 doom.
3.5 million.
Doom, doom. 1 million people. Cost to the United States, you and I taxpayers, $60 billion for angioplasties. So let's get to, okay, so you and I, people forget about chest pains or upper body discomfort or pain down an arm or neck or shortness of breath. So it's easy to miss heart attack symptoms. High blood pressure is called the silent killer. But what is within the grasp? You didn't say uncle. I'm so impressed.
I'm not.
You are
no,
one thick
Getting there.
man.
it's good information.
Wow,
Yeah.
unbelievable. So I won't give you all the other costs of pacemakers and all sorts of other things. It adds up
Staggering.
to $350 billion. That means that when you and I meet some of our brothers and sisters who are 60, 65, 70, 75, 80 years old, most of them, half of them, are going to die of a heart problem.
Yeah.
The coronary vessels, which are extremely small, that go over the heart, that feed the heart, get clogged, leads to electrical problems like needing pacemakers. And however, it's something that, without drowning ourselves in the, wow, that's, do we really want to go out that way? I mean, religious people, non-religious people, people curious, people got grandchildren. We're all going to die.
Yeah.
But it takes literally, sorry, not a good joke, the breath from us. We can't be physical. We can't pick up kids, our grandkids. We can't enjoy. So it is one of the biggest factors is something like dietary dairy, meat. Doesn't mean everybody should be a vegan. It doesn't mean you should never have bacon but the preponderance of the seduction that we need milk, of how growing up as kids we're so eat your cheese with everything, is it adds to hardening of the arteries. It's a problem.
So let's talk about something that has been in relationship to this, what you just mentioned, and dairy and milk, and over the last number of years, the other kinds of milk, like almond milk, has come into play.
Yeah, soy milk, rice
soy milk,
almond milk.
Yeah, all these things. I mean, I guess they call them milk. They're really not, I guess, in reality.
Because our brains see white liquid, liquid. We could have called almond juice, soy juice.
Yeah.
Doesn't sound right these days.
Right.
But, we're creatures of habit.
So if you crave that sort of thing, I mean, is that a better alternative?
Well, there's no fat. It's not an animal fat.
Right.
The way, what is milk, Ken? Milk is mother's milk for a calf that weighs about what you and I weigh to grow into a 2-ton animal. The length of those protein chains, I know. Wasn't the milk lobby unbelievably successful to think that you and I needed it, in the young age? You're about 40, 45 years old. And I'm 38.
I'll take that. Yeah.
So things like almond milk and soy milk. Almond milk is extremely high in calcium because almonds are high in calcium. But you're not getting any of the dietary fat. There is some fat in almonds, as in if you crush almonds like peanut butter, you'll see there's almond oil, but it's not an animal fat. It doesn't have the same kind of pushing to the side walls of the vessels of our plumbing in our body to cause what you and I know of as plaque. So this long-term, big Scrabble word, atherosclerosis, is the hardening of the arteries, which is a circulatory problem that leads to strokes, that leads to heart attacks, etc. Yeah.
But on the other side, there are those people who are going to say that there are nutrients in milk that you are not going to get from, almond milk or soy milk or any of the other items that have come along within the last number of years.
You know how much I like you, Ken, right? You do know that.
I do.
So if somebody said that, I would say they're either very ignorant or they're paid by the dairy lobby. So what I heard you say is that somebody would say that there are nutrients that are important in milk or dairy that we're not getting in almond milk. Well, that's true. You don't get in peas what you get in carrots, and Brussels sprouts don't have the same thing as broccoli, and almond milk doesn't have all the same nutrients in dairy. But that's not to say that you need the nutrients in dairy. What are they? They're protein. Well, have some fish if you want, or have some almonds, or there are a lot of other protein substitutes besides having milk protein. And then milk, the hype was they're good for your teeth and good for your bones and high in calcium, except that if you look at calcium levels of carrots and carrot juice and almonds and other kinds of foods, again, dairy does not have a monopoly on the nutrient calcium, which is what a lot of us bought into, that we need milk for growing children.
Hmm.
Are you growing anymore, by the way?
Oh, I'm growing, but
You've
yeah,
grown.
not in a
Past
positive
tense.
way.
Yeah,
Yeah.
you're not. Yeah, so you don't need milk. It's a hype.
I need it for my cereal, but no, but I
Almond
have to
milk.
say I have been doing that.
Thank you.
Yeah.
Thank you. Less dietary fat.
And what kind of cereal should I be eating, other than Frosted Flakes?
Oh. Are you giving me the gift of having an annulment and a separation between you and Tony the Tiger? Are you ready to split ways with Tony?
I think I am. I think I've reached that point in life, yeah, where I have, yeah.
Yeah, well, there are healthy shredded wheats that are not dipped in sugar.
Mm-hmm.
If you want a morning cereal,
Right.
There are granolas that don't have sugar in them. There's a really good one. I'm going to bring you one next time we do a show.
Yeah.
I use a really great organic granola out of a company in Burlington, Vermont.
Oh.
That's really great.
Huh?
But if you're going to do a cereal, there are more whole grains, not white flour, less sugar coated. And then if you want something sweet, put some raspberries in it, or some blueberries, or some whole raisins, or something.
I usually do bananas if I do anything.
Preferably organic, because remember,
Yeah.
inorganic bananas are not my favorites.
Okay.
So there's lots for us to talk about what your listeners, what my clients, what anybody who has any kind of interest of, God, what is it like going to the moon? No, it's not like going to the moon to die in your sleep. At least optimize your chances versus carrying around 20, 30, 40 pounds, drinking tons of alcohol, eating lots of sugar, which robs your body of calcium. The heart is a muscle. Muscles need calcium. The heart is bathed in a solution of calcium. I'm getting too technical now.
That's okay.
It's
No,
okay.
Yeah.
So there's a lot that's how the heart doesn't function well in terms of the electricity that's going to trigger. But then there's also the cardiovascular disease where our plumbing, the arteries and veins get really clogged and blood flow is just a mess. So I have a whole bunch of tips to give you. So we end the show on something other than worry.
Right. Well, I guess the question would be, can damage that has already been done be reversed?
Yeah. So not approved by the American Heart College, not approved by a lot of cardiologists. However, as a naturopath, I don't do what I'm about to tell you. It's only done by MDs. There is something called chelation therapy. Chelate is a Greek word, means to grab on, and think Pac-Man. So there is an IV therapy. I might use an oral version of chelation, which will eat the plaque Pac-Man-like. And the answer to your question is, it's not going to happen in a year or two for a young man like you, 50, 55. But 70, 75, 80-year-olds will do 8, 10, 12 chelation treatments. It's a little pricey. Your insurance is not going to cover it. But there are all sorts of MDs all over the world that will do IV chelation. Now, again, that doesn't mean you might never have a hamburger, or you're never going to have a cheeseburger, you're never going to have a piece of pizza. But we're talking about decades of plaque that it's dangerous to just walk around and you're 72, 74, 76, 65 thinking, well, I don't have any chest pain. I don't have shortness of breath. I know. But when you go into your doctor and he listens to your heart, you're really not getting evaluated. And then it gets worse. I remember when my father, God bless him, passed away, went in and I spoke to his cardiologist, and his cardiologist said, well, we put a stent in one vessel. And I said, well, how are the others? He said, well, one was about 45 occluded, that means blocked, and another one was about 55%. I said, wow, so it was pretty blocked. He said, well, we only do things when it's 65% or over.
Well, that's pretty scary.
So that's scary.
Yeah.
That's if you do something called an angiogram, where they put a dye in and they're actually looking at how much. But the whole point is, you go to have a physical, regularly with your PCP, my doctor, man or woman who you like a lot and is competent, but they're looking only after you already have symptoms. And what they think of as normal is so far from ideal.
Yeah.
Yeah. Should we get to the tips on what we can do? We're on a commercial break.
In a second.
Okay.
We'll tease the people. That's what we do. It's a tease.
Okay.
In radio.
Oh.
Dr. Barry Taylor is with us. He is the author of Love Your Body. drbarrytaylor.com for more information. That's barrytaylor.com. And he is with us. If you have any questions, comments, views, ideas, opinions, 866-823-1077. We'll take a break. Kale and Company will continue with Dr. Barry. Dr. Barry Taylor is with us, the author of Love Your Body. All right, we want some tips how we can help our hearts as best we possibly can.
How about an app on your phone that helps you walk?
That helps us walk.
Yeah.
Okay.
As in walking.
Okay.
I mean,
Walking's great.
2-3 days a week.
Walking's a great thing. How about 7 days a week?
Well,
like J-Dog.
Well,
yep.
If you're into it for 7 days, the reason I don't start my patients and when I do workshops and teach on 7 days is because I'm interested in people having wins rather than setting the goal too big and then they feel guilty because they fail. Mm-hmm. Let's just set it up 2 days minimum, and 3 or 4 days is a go for, and then a week later, 2 weeks later, we'll talk.
All right. So
what
app helps you walk?
Oh God, I have some handouts that I'm gonna send any listeners if they want to send me their email, and I will include the name of an app because I apologize, I don't have the name of an app, but there are a number of really great ones out there for walking.
Do you think it makes it? A lot of people, have their watches now that shows them how many steps they do.
Yeah.
I think it's a good thing. I think it encourages people.
I don't have one, and the clients and friends that do love it. Every single night, I did 4,300 steps. I did 7,600 steps.
Yeah. So
they have goals of 5,000 steps a day. So the reason I started with walking, Ken, as a first tip is because weight is such a cardiovascular risk. Mm-hmm. And if people could start to lose 2, 3, 4, 5 pounds, difficult around the holidays when people are eating so many sweets and so many breads and so many cakes. However, there are a number of things supplementally that are easy as well. Vitamin E. It's got to be mixed tocopherols, minimum of 400 international units. There's one that I carry in my Love Your Body line. The truth is there are a number of really good vitamin E's as long as it says mixed, M-I-X-E-D, mixed tocopherols, T-O-C-O-P-H-E-R-O-L, tocopherol, as opposed to just one of the fractions of vitamin E. Then you know you're getting a synthetic form of it. So you need a really good, high-quality vitamin E. Mm-hmm. The other thing is a lot of listeners might know, is omega-3 fish oils in high potency. I make one in the Love Your Body supplement line called Healthy Omega Forte. There are a few other ones at a health food store. Nordic Naturals is a great brand. And then there are some that are, not so good. A real high-quality fish oil instead of, dare I say, an aspirin a day.
Okay.
There are ways to just Google omega fish oils, and they make little gummies for little kids, and it needs to be a good minimum of 1,000 milligrams per capsule. You want to do 2 to 3 capsules a day, and that's not that's why I can continue to have my ham and Swiss sandwiches. Right. That's not why I can continue to have my corned beef and roast beef and pastrami sandwich, unless you're doing it once a month or once every 2 months, and I'm not even recommending that. However, something like omega-3 fish oils is really great to help the blood normalize. So something else at a health food store, most supplement companies don't carry it, but you can get what are called lecithin granules, Lecithin, lecithin granules, and that's really great. See, an egg has cholesterol and lecithin, but when you cook the egg, the heat destroys the lecithin. So if you can take a few lecithin granules and sprinkle it over Tony's Frosted Flakes or a good granola or put it in your smoothie, lecithin, it's a little tasteless, but it's also really good for the circulation. Arginine is an amino acid. I put it in a powder that I make in the Love Your Body line called Healthy Circulation. It's really good for men who have erectile dysfunction. We could do a show on erectile dysfunction. But it's also really good to increase nitric acid, which is really good for the blood to flow better. There are herbs, many. One is hawthorn berries, as one of the main herbs that helps the heart beat better as a muscle. That's what vitamin E does in the vitamin line. And you can get some teas if you go to a health food store and just look for a box of tea that says heart on it. And those, instead of getting a black tea, those are herbal teas that are really good to strengthen the heart as a muscle. Now, we need to say something about one of the biggest drugs behind Viagra in the United States, around the world, are the whole classification of statins. And amazing how many tens and tens of millions of people, accounting for hundreds of millions of dollars of sales, profits are crazy, of people who are taking statins, and that they think gives them license for more bacon or to continue to eat all the dairy and the cheese and the whatever. So I have clients that would like coaching on, can I go off my statins? And the answer is, you don't want to go off your statins and go on nothing. And there are all sorts of nutrients. I'll send it to people if they send me their email and say, send me the outline notes that you used for Ken's show on healthy tips for cardiovascular, and I'll send you some herbs that are really good to help reduce cholesterol levels.
So where do they send it?
Dr. Barry at drbarrytaylor.com.
Dr. Barry at drbarrytaylor.com.
Right, yeah. And I'll send them stats. There are a lot of great fact sheets about all sorts of things to know. And the takeaway is that, if you want to learn about CoQ10 and its ability to have, a lot of athletes use CoQ10 because it allows the heart to use oxygen more effectively. And you have to take a lot of it, but it's a supplement that some people do. So it's a teaser tip for a lot of people listening to the show that there is a lot that we can do.
There is hope
to have healthy hearts.
No, but you've got to work at it.
A journey of 1,000 miles begins with a couple of small steps.
There you go. And no pun intended, but walking is a good start. Yeah.
Thanks,
Dr.
Ken.
Barry Taylor, always a delight to have you with us, and we look forward to having you back in the not too distant future.
Hope to see you soon.
Always a pleasure.